confident in all aspects of the clean needle technique to ensure safety when providing treatment. Now that we have that increased risk of spreading infection because we're inserting a needle below the dermis, clean needle technique is very important, and we'll be talking about that. We're going to be reviewing all precautions and contraindications to acupuncture and dry needling. We're going to learn all potential complications and management strategies of treating a patient using acupuncture or needling of motor points. And we're going to develop confidence in the immediate clinical application of a selection of the most clinically common acupuncture points. So by the time you leave here, you'll have enough points that you're going to be able to treat almost all common musculoskeletal conditions. Any questions?
That will never be someone who's pregnant with our limited training.
With your training, no. Okay.
Today you're going to learn about 15 points, and just keep in mind the points you learn today, they might not make sense in terms of like creating almost like a way of organizing the points in your head, because the points you're going to learn today are throughout the entire body. And we're teaching these ones because they're more systemic benefit. So you're going to learn a point in the elbow, and while yes you can use it for elbow issues, you're going to learn to use it for other issues as well, more systemic things. And that way, when you come out of today, you can actually treat patients from a systemic standpoint, even if you don't know 10 points around the elbow that you can do. Okay? So often students will say, I don't get it 100%, but it's because we're literally covering the entire body. When we get to the shoulder course and you're learning points around the shoulder, around the elbow, around the wrist, like, oh. So just keep that in mind,
And
okay?
remember that the courses build, and so when you may feel overwhelmed in terms of what you're required to know and what you're learning, but they do build, and as Dee said, you may feel, oh, I don't get this, and it doesn't make any sense, but believe me, in the next 3 classes it will make sense. Okay?
Any age?
No children.
limit?
I would say no one under the age of 12, or even maybe 16, I would say.
And I've needled individuals are between 12 and 16, and usually what we recommend is if they're not old enough to stay still, and usually anyone under 16 can. Like literally the needling was, I would put the needle in, get the daichi, and you're going to wonder what daichi is, Mary, who's going to talk about it, and just take the needle out. So I'm going to stimulate the same points, but I'm not going to leave the needles in like I would normally do with a regular treatment.
Yeah. We sort of say, you can work on your own children if they feel that they're, open to it, but probably in your practice, maybe 16 would be the limit, age limit. We're going to talk about clean needle technique. Clean needle technique are a series of practices that were created in order to prevent the spread of infection during invasive treatments. Procedures below the dermis being one of those invasive treatments. The things you need to understand and do, you have to be very aware of infection control. I believe that the College of Massage Therapists actually has on their website a whole manual on infection control, so you may want to revisit that now that you're going to be working more closely with blood and body fluids. You may want to revisit that manual. Hand washing, always important. Hand washing before and after you needle someone, always. Hand sanitizing is fine, but it doesn't replace hand washing.
Did you ever use gloves at all?
Yes, and we'll talk about cases that you would have to use gloves. Say, for example, you had a person who was immunocompromised, someone that was HIV positive, someone that you knew had hepatitis B or C, you would want to wear gloves. That's why it's always important on your intake case history that you now have a section where you're going to ask if someone has HIV or someone has hepatitis, because you're at risk, right? And if you do know that, I've had a few HIV clients, I always wear gloves. Okay. Or again, if you have open cuts or open wounds on your hands that aren't healed and you're doing acupuncture, it's a good protocol to wear gloves. I didn't know that if you have herpes on your hands that gloves don't protect from the transmission of herpes. So they always say to wait till the sores are completely healed before you treat anyone. I didn't know that. So. All right. germ theory, we're going to talk a little bit about what are different kinds of germicides, so what are disinfectants, what are antiseptics, what do you need to use in practice. Packaging, we're going to talk about needles, because we want to make sure that the needles have not expired. If you look on your boxes of needles, they should have a lot number and an expiry date. So you don't want to use any needles where they're past their expiry date. Tom always says, don't buy needles that have fallen off the back of a truck in a dark alley from if you're going to get a deal, be wary of the deal, because you may be getting products that have expired or have been contaminated or have gotten wet. Sometimes the boxes will have gotten wet, or the seal on the packaging of the needles is broken. Do not use those needles, because they are now contaminated. Once you open this package of needles, they're open to air. Then they're still sterile because they're inside the tube. There's a tube that covers the needle, so they're still sterile. But once you take the needle out, it's now open to the air. Okay, so you have to be very careful in the way that you handle and insert the needles into your target tissue and remove and dispose of the needles. So clean needle technique is not just the clean needle, it's the whole protocol that you undertake when you're going to needle someone. So it starts with washing your hands. It starts with being sure that you're using sterile single-use needles. It's ensuring that the site, so if you're looking at a person's skin, you have to make sure that the site is clean. So if somebody's got dirty feet, would you put a needle in it? So you have to clean the area first. So cleaning just means using some kind of mild detergent or soap and water to clean the area. And then you want an aseptic or a clean, sterile field that you're going to be working on. So in this course, we recommend the single swab with alcohol to the point. So starting at the point and swabbing in an outward circular motion from the point. So you've washed your hands, you've got your needles, you're making sure that they're sealed. You're only going to open your needle when you're going to treat the person. Okay, so open your needle, remove it from the packaging. You're going to look at the site where you're going to acupuncture. You're going to make sure first that the area is clean. If it's not clean, you're going to clean the area with mild soap and water. And then you're going to make sure that you have a sterile field so that you are swabbing the area with alcohol. And they recommend, again, you swab the point. You don't rub it back and forth like this. You just take a single swab over the point. Now, I'm sure that you've probably heard that there are many different ideas about needling and clean needle techniques. Some schools, some programs teach that you don't have to swab at all. That you can just needle, put the needle in, take the needle out. You don't need to use any alcohol.
Just curious, what would happen if you're using expired needles for, let's say, a week or days or a month within the expiration?
Well, I think that if anything happened, you would be liable.
Yeah.
And now the college is also requiring that you record the lot number and expiry date on your documentation, because someone, and also the length of the needle you're using. They want that documented in your files. Because what if something happened and you had to prove that you used the right length needle, or if it had expired and somebody got an infection or something, or it broke in somebody's skin because it got brittle or degraded.
Prior to these are single-use needles that you use them and go in the garbage. The needles used to be reusable. You used to sterilize them with the autoclave. So ever since they started using these single-use needles now, the expiration date is based on how long that needle can stay sterile in that packaging, because you're not using the autoclave anymore. So it's just like food, kind of. You know how there's that expiration date, and yeah, you can take a chance, but it's the
risk and the liability.
Exactly, you're taking that risk, right?
Yeah.
So it's just that expiration date guarantees that needle is sterile in that package. Because remember, even food, if you leave a carton of milk in the fridge, even though it's not open, if it goes past that expiration date, what's inside is no longer good.
It's no longer
So
good.
it's the same type of concept, so you really want to stick to it.